Fibroid is a most common problem what these days the women in reproductive age group are being diagnosed. It is being the most common reason for infertility with mass in the abdomen. So they tell that, doctor, I feel I'm putting on weight, that too specifically in the lower abdomen, I'm feeling heaviness. I can't hold the urine for a longer time, or the bleeding and pain has increased over this last 6 months to 1 year. That's what the patient complains. How do we diagnose? Is it a fibroid or is it some ovarian mass? Apart from the clinical examination by a doctor, we do imaging facilities like ultrasound. Ultrasound is the basic modality which we do. Ultrasound pelvis will tell whether the mass is arising from the uterus or from the ovary. Usually fibroid is a solid mass where the location, things and all will be seen. It depends on the location of the fibroid. Sometimes it is arising from the inner side cavity of the uterus. Sometimes it's on the surface. So on the surface, until it is a very huge mass like 10-15 centimeter, it's not going to cause much problem for the pregnancy, conception or fertility. But if it is inside the wall or towards the inner side of the uterine cavity, these patients can have irregular bleeding, in between the periods spotting can be there, or they have severe pain and bleeding during the periods. But sometimes we may need the help of higher imaging modalities like MRI pelvis. Why this is required? For the fibroid mapping. The best to know how many fibroids are there, where they are exactly located. Sometimes the fibroids can be in the broad ligament. It means the lateral part of the uterus is called, that area is called the broad ligament. If there the fibroids are there, they can put pressures on the ureter and ureters can get damaged during the procedure. So for these kind of patients, we can do ureteric stenting prior to the procedure so that ureters can be identified easily during the procedure and their injury can be prevented. So this kind of planning and team management is very important for the patients, where location of the fibroid plays a very important role, and the patient whether planning for pregnancy, where we have to save the uterus for the future conception. So we need MRI help for the fibroid mapping. So what happens after this fibroid mapping, all the evaluation is done. So you have to be in good hands. The surgical skills of the surgeon to do only fibroid removal. This is called myomectomy. So we do laparoscopically the myomectomy procedures. The suturing techniques, these things is very important. Complete hemostasis has to be ensured, and pre-operatively proper evaluation by our anesthesia team matters a lot.